All right. Well, South Africa has started today with the second phase of the vaccination program, with the vaccinating people that are 60 years and older. We're now joined via Zoom by Dr. Anban Pillay, who is the Deputy Director General for the National Department of Health. Take us through the plans that government has going ahead with this phase that has indeed started today. A very good afternoon to you, Dr. Pillay. Thank you so very much for being with us here on SABC News this afternoon.
Good afternoon to you, and good afternoon to the viewers. Yes, so we are quite excited that we've started the phase 2, which I think was long awaited. We've just completed the phase with healthcare workers, which we started in February, and we are going to obviously have to complete some of that. We did close to about 500,000 healthcare workers through the Sisonke study, and the balance of the healthcare workers will have to be completed during this phase. In addition to that, we have focused particularly starting with the over 60s, and today across all the provinces, the provincial health departments have been visiting the old age homes where they will be vaccinating the elderly who would be unable to usually come and stand and queue in our facility in order to receive a vaccination. Hopefully that's going to be done in about a week. And then we will continue at the same time to vaccinate the over 60s in our healthcare facilities, both public and private. A number of private pharmacies, as well as the public health sector, will be ready in order to be able to vaccinate those over 60, which we started today as well.
Dr. Pillay, let's talk about what went into preparing for today, for phase 2 of the rollout of the vaccines. It seems as though things went relatively smoothly from your side. And I wonder what went into that sort of preparation. And perhaps if you can tell us if there were any stumbling blocks that, and I'm sure you're getting all that information as the day does progress, but perhaps you can share some of that information with us at this point.
Yeah, I mean, there are always going to be, I think, challenges as we roll out a program as significant as this. I think on the IT side, there's certainly been a number of areas where colleagues have not been able to log on, etc., and needed some assistance on the IT side of things. I think in addition to that, there were people that received messages a bit late and were not able to come through to the facilities to be vaccinated. There were areas where there was misunderstanding about who must be vaccinated, etc. So those kinds of issues arose, but they all were resolved during the course of the day. We didn't schedule a lot of people today simply because we wanted to make sure that on the first day we make sure that the systems are working well and any kinks that are in the system are ironed out. So tomorrow we certainly will be allowing facilities to register many more people, or schedule many more people actually, for vaccination. And I think we'll see the numbers increasing from tomorrow.
And Doctor, let's talk about, whether or not realistically we'll get to, what all you medical experts have been talking to us about. There's been quite a new term for the rest of us, but as that herd immunity that we've been hearing so much of. And I wonder if realistically we will get to that point where we reach that. And also, let's not forget, we're also dealing with the issue of people who simply don't want to be vaccinated. There are some people who, at the end of the day have distrust or have issues against the vaccines for some or other reason. And I wonder, dealing with all of that and some of the other stumbling blocks that we've had throughout the vaccination drives, if we will realistically get to this herd immunity in time before we lose so many more other people.
I think it's important to separate herd immunity from personal protection. So herd immunity is the point at which sufficient people are vaccinated where the transmission of the virus is so difficult that you don't really have outbreaks of infection. However, even if we didn't reach herd immunity for the reasons that you outlined, every individual that has been vaccinated receives personal protection. So he or she has a far more reduced rate of hospitalization or mortality if they contract COVID. So I think it's very important that people remember that even if they aren't aspiring for herd immunity, we certainly are achieving personal protection for every individual. There are a lot of debates about herd immunity and what number needs to be achieved in order to get there, because as the efficacy of the vaccine reduces, you would find that the number of people that need to be vaccinated increases quite significantly.
Yeah.
So I mean, there's still a debate globally about what that number must be. But despite that, we think that personal protection of any individual is very important in order to prevent the hospitalizations and mortality that you reported actually at the beginning of the show.
Yeah. Doc, just in closing, I mean, when we're talking about reaching everyone, and I mean, at this point, we're trying as much as possible to specifically vaccinate people that are 60 and above. I want to talk about accessibility and really for those elderly people living in, say, villages or far off places, far to reach places. I mean, are we ready to, and are we in a position where indeed we are catering for everybody? I mean, I think in urban areas it's kind of, it might be a little bit easier, of course, to reach everyone, but I'm really particularly concerned about those areas that are far off and, you know, in the villages.
Yeah, and that's also our concern, because if you look at the registrations that have come through the EVDS as well, you will note that they are predominantly in the affluent metro areas of the country.
Yeah.
And so an extra effort has to be made by our colleagues in the provinces to make sure that we reach those in the more rural communities. That's why you'll notice that the vaccination sites that have been set up across the country are almost in every sub-district, even within the rural sub-districts, because for us it's really important that we reach those communities as well, because they may not have necessarily received all the information in order to register or access the vaccine. And I think our colleagues in the provinces are very alive to that challenge that they need to address.
All right, Dr. Anban Pillay, thank you so much for giving us your time, and no doubt it is a busy time for you, so we certainly do appreciate you taking out some time to talk to us. Thank you.
Thank you very much. Thank you.
All right, that is Dr. Anban Pillay, who's the Deputy Director General for the National Department of Health, of course, as phase 2 of the rollout of vaccines indeed kicked off today.